Hello, I'd like to welcome you to A Healthier You. I'm Larry Macon Jr., pastor at Mount Zion Oakwood Village, and I'm also co-host on the show It's About You on WKYC Channel 3, where weekly we recognize people that are doing great things in our community. However, this web series, It's About You. Yes, it's all about your health, and it's about university hospitals being a beacon of light even in a dark situation. They're helping us, again, live a healthier life. And so I'm here with Dr. Craig Frey of University Hospitals, and he has just been so gracious to come here and be interviewed. So what's our topic for today, Dr. Frey? And so good to have you.
Thank you very much for having me. Yes, so today we're going to talk about wound care and wound care in the community and what we can do to help all of you out to look for some symptoms of anything that may be concerning and get you to the appropriate place so that we can get you treated early and effectively to prevent any major complications or long-term problems associated with any wound that you may be exposed to.
I love that, early and effective. So tell us, Dr. Frey, what are some of the wounds that you treat, and are there any providers in the center that can help with that?
Great question. So me specifically, my background is podiatry. So I treat everything below the knee when it comes to wounds, trauma, a whole variety of different pathology. However, at the wound center, we're equipped with multiple different doctors from multiple different specialties. These include podiatry like myself, plastic medicine, plastic surgery. We're soon going to have vascular surgery involved in the wound center as well. So we're able to treat, from head to toe, essentially, many different types of wounds. Some of the common examples of wounds in general at the wound center, and specifically with me, are diabetic ulcers or venous ulcers or pressure ulcers. A lot of these are very common within the general public. In fact, up to 70% of patients, within specifically a nursing facility, have pressure ulcers. So these are all preventable ulcerations and can be long-standing and very difficult to treat. But the sooner we get you treatment, the quicker we get you healed.
And just for our viewers, how do you characterize this?
So any type of what we refer to maybe an abrasion of the skin, it can be a full thickness wound that goes beyond the skin and develops some type of bleeding or involvement of the muscle and deep neurovasculars or venous or arterial or nerve structures underneath the skin and all the way down to the bone even at times, which is a very, very big deal that results in a major infection that puts you at a much higher risk of amputation and multiple surgical debridements to get that under control.
Wow. Now, we also know about hyperbaric oxygen. Can you let us know a little bit about that?
Sure. So hyperbaric oxygen is not necessarily new. Around the Cleveland area, you might hear about LeBron James having hyperbaric oxygen chambers in his house and now out in LA, of course. But hyperbaric oxygen is basically a chamber that you go into anywhere from 60 to 120 minutes, depending on what type of wound that you have. But it essentially is a specific pressure chamber that delivers 100% oxygen to the body. And what we're doing is essentially super saturating your red blood cells with oxygen, which is a major component to healing. And specifically for my profession as well, the blood flow coming down to your toe, which is about the furthest area away from your heart, we need as much oxygen down there as we possibly can. And certain patients, based off of their diagnoses, may qualify for this type of treatment as an adjunctive means for healing.
I love that. So I'm quicker. So my question is this, with wounds, there comes amputations. So how do you reduce those amputations in your patients, especially those with diabetes? We talk about diabetes being a very big contributor to wounds of the body. How do we stop that phenomenon?
That's a great question as well, and a battle that we deal with on a daily basis. So to talk a little bit about how common amputation and wounds are, 1 in 4 families know a family member or currently involved with a family member with a chronic type of a wound. And chronic wounds are one of the major leading factors to amputation. Approximately 30% of chronic wounds will result in an amputation. And depending on the literature that you review, an amputation on one leg results in an amputation within the other leg within about 2 years, over 50% of the time. And the mortality rate or death rate associated with these wounds following an amputation is about 75% over the next 5 years. So this is an extremely important thing to address early Early evaluation and treatment will help reduce the risks of amputation associated with your chronic wounds, as well as continued follow-up, which is why at the Wound Center we encourage weekly follow-up with us depending on your diagnosis to help prevent that from happening. And unfortunately today with COVID running as a very high concern for patients and patients being very concerned about going out, we do offer some forms of telemedicine to help, but it really doesn't do very good justice to seeing a patient and evaluating them in person. And the amputation rate over the past 9 months in our field, which as we discussed is already very high, has increased about 10 times the amount as it was a year ago today because of lack of awareness and treatment with a healthcare professional that's equipped to manage these types of wounds.
Wow. How has COVID-19 affected the Wound Center?
You know, as I mentioned, it's affected us a lot in terms of our patient volume. Patients are afraid to come in to see us. We take all the standard protocol measures that is enlisted throughout the University Hospital's health system in conjunction with the state of Ohio and infectious disease guidelines. So we are here to protect you, to care for you. I'm not wearing my mask right now, but I assure you, as soon as I leave my room, we are wearing masks and goggles all day long. We do temperature screenings for patients to be able to prevent some major complications. However, we know COVID exists, whether we're in the hospital, out in the environment, you know, at grocery stores. We do our best to protect you, but allowing something like a wound to persist because of fear of COVID at times puts you at a much, much higher risk of infection and mortality as well. So it is important for you to see your specialist regularly, and we offer all the guidelines rather, and safeguards to make sure that you are safe and healthy when you come in to see us.
That's great. Do you want the world to come see you guys, or how do you make an appointment? Yeah,
so to make an appointment, all you have to do is call. We take walk-in, or not necessarily walk-in appointments, but you don't need a referral from another provider. Oftentimes we do get referrals from other providers. That's a major source for us. But if you have a wound and you're concerned about this, I always tell patients 2 hours of coming in that may seem like a waste of time for us to tell you everything looks good is worth it, because not coming in can be so catastrophic. And all you have to do is give the office a call, 440-735-4755. Again, 440-735-4755. And our scheduler will set you up with a specific provider that is specialized in your type of wound to get you the appropriate practitioner to work with you and get you healed up and along the way.
Well, Dr. Frey, I really appreciate this information. And I just wanted to ask you before we go, is there any indication that a person can have to know, hey, I need to go to a wound center for this wound? You know, some people say just bandage it up or throw some alcohol on it. What should you look for to know that we need to get a hold of University Hospitals and this wound care center out in Bedford?
Sure, that's a great question as well. First thing I tell all patients is, in a society where we utilize the internet for everything, it's not necessarily a great idea, because I get a lot of home remedies for treatments of wounds that are actually counterintuitive and can cause the problem to be worse. Any type of wound is something that you should have evaluated by a physician, even if you are relatively healthy. However, if you are not healthy, you've got a history of vascular disease, heart disease, high cholesterol, diabetes. These are all factors that delay wound healing and can put you at risk of the wound worsening or leading to an amputation. So I encourage you, even if it's one visit, to come in for us to say, yes, everything looks great. It's worth the phone call. But many times patients end up staying within our wound center so we can offer them the multidisciplinary approach to be able to heal your wounds.
Got you. Well, I appreciate all this information, Dr. Frey, and thank you again for caring for our community. And to all of our guests, remember to stay in contact with me as I continue to interview doctors and leaders in our community that are trying to make you stay healthy and safe. Remember, good health equals good wealth. Thanks again, Dr. Frey, for being with us.
Thank you for having me. It's been a pleasure.
Pleasure's all mine.